Hello, this is Yohanna Andrade. I'm a medical doctor. I'm specialized in pediatrics. I am board certified and fellow of the American Academy of Pediatrics. Today, I'm going to talk about something that we don't like to talk very much, which is vomiting and diarrhea or throwing up. Usually, doctors will refer it as gastroenteritis. So, what is diarrhea? So diarrhea is usually when your child has many bowel movements or they are very liquidy. The causes for diarrhea, they could be infectious or non-infectious. The common causes in infections are usually the viruses. There are other causes like bacteria and parasites that are not very common in this country. Non-infections basically are produced by medications, especially antibiotics. So what you can do at home when your child has diarrhea, basically you want to keep them well hydrated. We'll talk about that a little bit later, but things that you can do. If you have a baby that is only drinking breast milk or formula, what you do is never stop any of those two. What you're going to do is you're going to offer smaller amounts but more frequent. If you have a child that is already eating some solid foods, so you can give mashed potatoes, mashed bananas, applesauce, rice cereal, that would be great. Also, you can give some oral rehydration solutions like Pedialyte. So you are going to offer it several times a day in between feedings. That will keep your child well hydrated. Water alone is never good for hydration because it's lacking of a lot of nutrients and electrolytes. Please stay away of any sport drinks. They are not designed to be given to children or babies. They can harm them. Other things that you can offer in children that are a little bit older, that they are already eating other things, is you can offer them Sprite or 7-Up or any other clear fluids. If the child is already eating any table food, you can reassume the diet, but you're going to avoid certain foods. Like what? You're going to avoid anything that is greasy, spicy, with a lot of condiments. So when you should call your doctor or your nurse line. So if you see that the diarrhea is getting worse with time, if you see any blood in the stool, if your child is having fever, or if he or she is showing any signs of dehydration. What is dehydration? Dehydration basically is when you are losing amounts of water and nutrients that are essential in your body. So how do you check for hydration in your child? So basically what you do is you're going to start from head to toe and you're going to check. If the baby still has a soft spot, if it's kind of sunken, that's dehydration. If the child is not crying or is crying but is not having any tears, that's also another sign. You check the mouth and if it's dry or no saliva. If your child is not peeing well, or if you see that the urine is kind of dark and scant, those are signs of dehydration. So you always should call your doctor or your nurse line.